Today we are pleased to be joined by Philip Meier, the CEO of a primary care unit with a strong focus on innovation and multidisciplinary healthcare models. Welcome.
Thanks for having me.
So before we begin, could you please briefly introduce yourself and tell us more about what led you to be leading a primary care unit?
Yeah. So my path basically started in the world of radiology and orthopedics. About 10 years ago, I co-founded with other people, other friends, other companions, a company that was innovating in the field of radiology with AI already, with diagnostic decision support systems, specifically targeted at musculoskeletal diseases.
Okay.
My role there was basically to develop the commercial side, build the product, build the market. So we worked in Germany, Austria, Switzerland, all the way to the US, all the way to Asia. So now this software is already used by outpatient centers, by hospitals, pretty much all around the globe. Yeah. And similarly to this trend, I would say, of AI in radiology, there was a new trend starting about 5 years ago. I would say primary healthcare in Austria. And I thought this could be my next great venture, my nextpreneur. And the combination of bringing in innovations, digitization into the world of primary healthcare, where there is no primary healthcare world or there is no digitization, that was very appealing to me. And so those three physicians that started the primary healthcare center were kind of like looking for somebody like-minded with my profile, and I said, okay, let's take on this challenge and let's do this together.
Perfect.
And for the last 2.5 years, we've been trying to move things along.
Perfect. So your primary healthcare unit handles hundreds of patients daily, hundreds of interactions daily. So what operational challenges pushed you towards the integrated diagnostics approach?
Yeah. It's really getting more and more complex. Yeah. So when you think about, we started with 20 patients a day. Now we're looking at 300 to 500 patient interactions through the various stakeholders. We have to take care of acute patients, of chronically ill patients, of people with appointments, and people who come in and just want to talk about their lab results. We have wound care. We have substitution therapy. We have disease modifying programs. We use social services. So it's already a small clinic. Yeah? And the more people we become, the more patients we see, the more complexity is added. We need things to go simpler again. We need things to go smoother again. And obviously when it comes to like patient pathways and journeys, you need to start thinking integrated diagnostics. Yeah? How can we apply technology to help us pre-analyze and fill, so to speak, our systems and give us information so we can take care of that patient better, faster, more efficiently.
Yeah, and here we are talking about making primary care units operationally intelligent. So what does that mean in practice?
I think that when we look at the world of general practice, let's go all the way back to general practice, right? Physician working with one physician assistant and then seeing a patient. That's very basic. It's very simple. You walk in, you put down your insurance card, you wait for the doctor to see you, the doctor discusses everything, you maybe takes your blood, sends you away, and then you'll come back. And so we do exactly the same thing, but when we add much more information, other interactions with other healthcare professionals. And well, first of all, that on its own is becoming more intelligent already because we're adding more information and we're adding more stakeholders. But then you can't multiply through physician interactions. The physician is not there to like fill out your paperwork with you. It's not there to talk about for an hour on problems not related to your immediate acute medical health, right? So that's the most valuable interaction is the physician time, and they are the ones who need to make the final decisions. It's their responsibility. But the rest of the team can support this in so many ways with so many, well, intelligent systems or just intelligent and smart operations. such as where do I enter? How do I greet the person in the right way, especially if they come in maybe for more social problems rather than medical problems? Where do I fit in the right patient journey, so that we can handle those interactions, which are still growing. Yeah,
Yeah.
it gets more and more, and I think that the intelligence part really comes together with the whole team, and yeah, I'll leave it at that. I think it's always going to be a team and a personal effort to make it more intelligent. You won't just add a system and things will become better.
Yeah, of course. And so you've talked about filling out papers and generally speaking, the overload of the physicians, of our nurses. So how can an integrated diagnostics approach help them reduce this overload? So we've talked about making the primary care unit operationally intelligent, but how does the integrated approach, diagnostic approach, intervene in reducing this workload?
So I would like to draw the bridge to radiology. When you have AI supported decision systems, they will give you a suggestion. They will pre-analyze it and they'll measure and they will calculate and they'll maybe give you a score. And you as a physician or you as a nurse or you as the medical professional have to interpret the data and do something with it so that the patient goes better. But it's not just you can't just put a system there and say, oh, I finally did it. You need to document it, right? So you need to end up in a system. You need the intersection of here's my new information. Here's already a pre-analysis, let's say of the ECG, right? So already get a pre-analysis. It's not on its own done by completing this analysis, this diagnosis, but it's giving you a suggestion. And you, as the medical professional, have now to decide. But you still need to get that information within your medical system, within the patient record, because that's the only way how you will get reimbursed, right?
Yeah.
And that's the important part. So it all comes together, not just the pre-analysis and the quality of that, obviously, but also the validity behind the integration of multiple systems, so everybody can see it, use it, and also be reimbursed for it.
Yeah. So, like you said in your presentation, the future is not physicians doing more work, rather systems enabling teams to work differently. How does that future look like?
Well,
and is he far away or not?
I don't think we're that far away. I think when we look at the primary healthcare system in Austria, the oldest primary healthcare unit is now 10 years old. So that's not very old, yeah. But there's now some history. There's now some validity. We now reached over 100 primary healthcare centers in Austria, and it's still growing. And we all learn from each other, and we all get smarter by sharing those informations, doing conferences and doing clinical presentations and local meetups. I think that the future is already happening with regards to shared responsibility along the patient journey. I think that we already have a huge impact on the healthcare system by taking off workloads from the hospitals, which was one of the first big kind of tasks. Can somebody with a cold not go to the emergency room, please, and be treated by their GP, right? So I think we relieve the system from that. And now we're adding more and more complexity again and see, okay, how much further than the emergency room can we go? Can we address internal medicine problems? Can we use something from experts that uses spirometry maybe in the system in the hospital? Can we analyze? Can we pre-fill data? Can we provide information? And this is happening slowly, very slowly, because of the systems that are besides the diagnostic systems essential to document and to bill and to reimburse and to innovate. Yeah.
So you've talked about data. So do you think that primary care is moving towards a more preventive and data-driven approach?
I would like to think so. Not everybody has the ability and the interest to go down that pathway, right? Some physicians and some GPs and some primary healthcare centers are just there to treat the patient. I think you have to have that mindset of saying, I want to make a change in the system, and therefore let's start collecting the data with obviously patient approval. Yeah, that's very important. Everything needs to be GDPR compliant, anonymized or pseudo-anonymized even when we start talking about that. But personalized medicine, I think, has arrived in primary healthcare just as much as it has in oncology. Yeah, we just need to start preparing all that massive amount of data that we're collecting daily, and we're collecting much more data than hospitals because of just so many more interactions that we have on a daily basis. So yes, we are already working with it. Do we have anything of value already that we have created with it? I don't think so, not yet. Will we be there in 5 to 10 years? Absolutely.
Let's hope so.
Let's hope so.
Thank you very much,
Thank
Philip
you.
Meier, for your time and for sharing your insights with us. It was really a pleasure talking with you.
Pleasure was mine. Thank you.